My patient, I'm going to ask if I can draw blood. If I have their permission to draw blood, I'm going to ask them to identify themselves, ask them to spell their name, say their name, date of birth, and then once he gives me permission, I'm going to go wash my hands, right? What do we do after we wash our hands? Sanitizer, right? Sanitizer is not what? A substitute for what?
Washing hands.
Correct. It is not a substitute for hand washing, right? Okay, so I would like to inspect my patient's veins. So I'm going to take my tourniquet, and I am going to put my tourniquet, right, 3 fingers above the antecubital fossa. Usually right on the peak of the bicep is where the tourniquet should go. You always want to make sure that it's smooth, that it's not twisted, because if the tourniquet twists, what does that feel like? You ever had a tourniquet? It feels like it's cutting into your skin, right? So even people with larger arms, you really want to try to keep that tourniquet as straight as possible. Okay? Now, I'm going to palpate for a vein. There's a nice median cubital vein, or medial cubital. We don't want the basilic, because that kind of hurts, right? So for our purposes for the school, if we have to, we're going to try to stay away from the basilic. Just the median cubital, and of course, the cephalic, right? Your cephalic would be here. My thumb,
right here.
yeah, so the cephalic would be here, where the basilic would be here.
Right.
It's kind of weird, yeah.
Oh, wait.
Sorry about that. Yeah,
So-
cephalic, if you go from your little finger and you trace upward to your shoulder, to your head, that's your cephalic. So here.
So,
Not your,
cephalic.
if you're doing this way, it's your thumb. Okay, yeah, so this way, your thumb
Okay.
goes
So-
to the shoulder
That's
and
cephalic.
up, yeah. So
That's what I. and
yes, yes.
Inside is
Inside
basilic.
is basilic, yeah. So
Okay.
this, I was right the first time. I'm just confusing myself. Okay, so 60 seconds is the minimum, right, that we can have this tourniquet on. So I'm just going to pull this off right now, and I'm going to tear open my alcohol. I'm just going to go ahead and tear it open. And I'm going to tear open my betadine. This is kind of hard to tear open, actually. These are kind of tricky and messy. I'm going to prepare my needle. Always make sure that your needle is in date. Obviously, we're practicing with these. These are expired. Okay, but you always want to look to make sure that the needle is not expired, right? And that the paper has not been tampered. So watch, if I turn this, oh, it's been tampered with, right? When in doubt, what do? Toss it, throw it out. So I'm going to open up the end that has the hub needle on it, right? We said there's that little needle there. Don't want to touch that.
Poked myself with that.
Yes, yes. Well, that's very honest of you. A lot of people do. I did too the first time. So we're going to keep this covered because this is the sterile part, right? We don't want to uncover our sterile part. I'm right-handed, so my needle's going to go on my right hand. My tube is on my left side. My gauze is on my left side because once I go in, my left hand has to be free, and I don't want to reach over. Does that make sense? All right, so I'm going to go ahead and tie the tourniquet. Okay. And now I'm going to go ahead and put on my gloves. These are nitrile, non-latex. I like purple.
Me too.
And you want gloves that actually fit kind of tight. Actually, these are not bad, but they should have even a more snug fit. So gloves should fit your hand almost like your second skin. The bigger they are, the greater risk you run of being stuck by a needle. Okay. So now, let's go ahead and clean with one betadine. Oh, come on. Of course, it's going to give me a hard time here. Let's open this up. Okay, so I'm going to take this Now, I don't really want you guys cleaning these arms because it may break down the initial materials that it's made with. But when you clean, you go from the center, you work toward the outside, yeah? And then alcohol, let's do alcohol. From the center, more so than the betadine, the alcohol is what breaks down the material. And from the center to the outside, yeah? And now what you're going to do is you get into place. Now, this vein kind of is going on an angle. You can see that, right? So I have to position my needle in such a way that I'm going to be on an angle. You have to take your non-dominant hand and you need to pull back the skin to kind of stabilize the vein. And the pressure on the skin actually kind of fools the brain into focusing on your fingers, pressing on their skin, so that when you go in with the needle, it kind of shorts out the amount of pain that they feel. But not only that, pulling the skin taut helps the needle go in more smoothly. The one thing you don't want is to have to force a needle in against skin or excess skin, right? You want to, it's like poking a balloon almost, right? You don't want any, you want that skin to be taut. So ask your patient when their arm is dry, get into position. You've got 3 seconds when you uncap this needle to go in. I cannot touch this area again, right? The only object that's going to touch and go into that vein is a sterile needle. So always think sterile to sterile, yeah? So take this off, find the bevel, and then to press, go into the vein like so, hold it, insert your tube. I always insert the tube without the paper with the paper in the back so I can see the blood coming in. At this point in time, blood should be filling up. I'm going to pull the tourniquet off. I'm going to gently take out my tube, invert, take my gauze. Always when you take your gauze, put it above the needle where you can see it. Don't put it over the needle like this. You always want to put the gauze above the needle, press down, gently pull the needle out, cover it, toss this in the sharps, fold it, ask the patient to apply pressure while you get rid of your sharps, yeah? And then, once you've gotten rid of all of your paraphernalia, peek underneath to make sure the blood isn't pooling at the site. If blood is still pooling at the site, you need to stay on it longer. You need more pressure, right? Because they could be on blood thinner. It could be a number of things. Maybe they're hemophilia. Maybe you're doing a factor 9 or a factor 8 study, which tells you we're looking for the absence of factor 8 or 9, okay? And then once it stops pooling, put a little bit of tape on it, they're good to go, okay? And that's a blood draw. That's the procedure you want to go through. And then if this is your patient, you're going to wash your hands, do it all over again, ask him questions all over again, just like he's a new person. Because why am I having you repeat this over and over and over again? What's the purpose of repetition?
Making sure you have the right
Memory. So that when you get out in the real world to do this sort of thing, you're not going to miss a step. You're not going to say, well, I can switch hands. One of the worst things, one of the things that you never want to do is you're here, right? And then you do this. This runs whatever hand you're dominant stays unmovable, holding that needle. Doesn't move. Okay, some people shake. That's okay, you'll get over it. The key to controlling shaking is breathing. So if you're the type of person that kind of, wants to shake, you know what you do? Breathe out. Insert the needle and go. Really zen. Make it zen. So never switch hands. Always use your dominant hand. Always put your fingers on the arm so that this is stabilized. You can't hold a needle like this, stable, right?
Mm-hmm.
You've got to have your hand on the arm, okay? Gently pull out. One of the mistakes that a lot of students make too, and it's part of learning, okay? It's all part of learning, is that you're inside the vein, right? And you're coming back out, and they do one of these numbers. Ow,
Ooh, that
ow.
hurts.
Yeah. You know, so you go in, and you come out the same way you went in. Smooth. In, out. One of the things some students will do too is they'll be in the vein, right? And when they come out, they'll pull it against the skin. Don't do that. You go in at the same angle, come out at the exact same angle, and up. Okay? And you have to, this is what we're going to practice right now. We're going to practice the whole procedure. All right, so we're ready to do this? You have to learn sometime, right?